It looks like everybody's in. So hello, everybody. I'm Charla from the Chamber of Commerce. Thank you so much for joining us for our town hall with Minister Patty Hajdu and MP Dr. Marcus Powlowski. We're so thrilled that they've been able to take some time to chat with us today, and really appreciate that. We know you both have very busy schedules right now, and appreciate you making the time to talk with our members. So what we're going to do, the sort of agenda of the meeting today will be both Patty and Marcus will make some opening comments, and then we'll open it up to questions from attendees. So what we're going to do is use your chat function. If you have a question, just put a question mark in, or you know, I have a question or something like that in the chat, and then we'll go through those in order. When it's your time to ask your question, I'll unmute your phone or your line. You can ask the question verbally rather than trying to type it all out, which I know can be complicated based on some of the programs we might be talking about. So hopefully that's clear for everybody. So without further ado, I'm going to pass it over to Patty first to make some comments, and I'll mute everyone else. So Patty, over to you. Unmute.
Mute, Patty.
Okay, Patty, I'm trying to unmute you. You've muted yourself. There you go.
I just did the exact same thing I did this week. That's crazy. Anyways, okay, so we are all learning how to work in a new and novel way, and it is not without its road bumps, that's for sure. First of all, I just want to thank everyone. This has been an incredibly difficult time for all Canadians, and I have received so many words of encouragement from so many of you, whether it's by email or other ways, and I just want to thank everyone, because every time I get a little boost from home, it actually makes my day that much brighter. It's been, as you know, very difficult for business in particular, but certainly all Canadians, and our government has been working extremely hard to try and figure out how we not only get through this from a health perspective, but how we get this through this from an economic perspective. It's been the biggest economic shock that I would say that we've seen in, you know, a very long time. From a health perspective, this is a sort of a once every 100 years kind of phenomenon, and certainly the economic impact is significant and severe. And I know that many of you are struggling to find a new normal. In some cases, businesses have not been able to continue. In others, businesses have adapted and been able to, you know, shift the way that they produce or they deliver or they operate. And I think all of us are looking forward to the new normal, whatever that might be. The intent behind the economic measures that we've been implementing have been around trying to sustain, as we see the economy sort of essentially put into a medically induced coma, we've been trying to sustain the life signs of the economy during this really difficult time. So, you know, the initial measures around the emergency benefit for Canadians was really to acknowledge that as we were asking people to stay home, that they needed to have some capacity to manage their essential costs. And so that was, as you know, one of our very early measures. Now we've got a number of other measures around business continuity, whether it might be loans, the new wage subsidy, those kinds of things. And so I think for me, today is really about listening to all of you in terms of what's working, what's still not working, where the gaps are, and how we envision this new normal. And if you have time, or if you've been doing some thinking about what that looks like when we come out the other end, that would be helpful too, because I think certainly as we start to look at how we adjust to that new normal, it'll be a large question looming for the government about how we sustain these measures or not, and how we ease them off, and what that might look like. I don't think, you know, I don't think we're ready to do any of that right now, but certainly I know those questions will start to arise. So some of you are forward thinkers. I know many of you are, and you might be thinking more broadly, and I'm happy to hear those comments, as well as possibly, if you have them written down, that you forward them to my office. Crystal Deputer is, as you know, my trustee partner in politics, and she's on the line, and she'll be documenting everything people say as well, so that we can get that back to the relevant ministers and teams, so that we can ensure that they have your feedback. And finally, I just want to thank Charla and the Chamber of Commerce. I know you've been doing an enormous amount of work to try and protect the fabric of our local economy and the sustainability of our small and medium-sized employers across the region. It's work that is extremely important. We want to make sure that businesses survive this very difficult time, and they have the tools to do so. And we want to be a strong partner at that local level as well as at the national level. So the work that you're doing at the Chamber to convene these meetings and to support these businesses and make sure that they're connected to the tools they need is critically important. So thank you, everyone, and I'll turn it over to Charla. Thanks.
Thank you, Minister. And so now, Marcus, I'll pass it to you.
Thank you, Charla. Thank you to the Chamber of Commerce for setting this up. Yes, the new normal, and part of the new normal is we get to look into everybody's house. So this was what I thought was the most amusing bit about virtual Parliament, is looking into everybody's little workspace. And it was interesting. I think Minister Baines won for the best backdrop. He had a nice painting, but there was some block guy who had a brilliant yellow kitchen, I think he was in. I also enjoyed that. Oh, another one was somebody had a pair of snowshoes in the background. I thought that was good as well. But thanks to the Chamber of Commerce again for putting it together, for being involved in getting out these new programs. Certainly we've had a lot of comments that have come to my office, and we have from time to time passed on those comments to the powers that be within the government. As I think everybody's aware, there have been a lot of programs that have come out really quickly, dealing with all different parts of the economy. And the analogy I use is when I was a kid, good friends of my parents were these Americans. This guy was an American engineer, and he was a Quaker. And during the Second World War, he was stationed in Northern Africa behind the front. And his job was to repair planes that came to him. The Americans were so eager to get planes to the front that they were coming really quickly off the production lines. And as a result, when they got to the front, they often had problems, like they shot off their propellers or their bomb doors wouldn't open. So he would fix them on the spot, and then he would relay back to the manufacturer in the United States what the problem was so they could repair it. So I think similarly with the programs that we're rolling out, they're coming out really quickly in order to meet an urgent demand. But as a result, they're not always totally fine-tuned. And so that fine-tuning comes afterwards. And Bill Morneau, who I've been very impressed with, he said early on, he said, look, this is the first day. We're not going to get it right the first time, but give us enough time, and we will try to get it right. So I know we've had a lot of people coming to the office telling us that they didn't quite fit into the programs. They fell between the cracks. That's certainly going to be the case. I think that was far more the case at the beginning. And as a result of listening to people like yourselves, a lot of those programs were subsequently adjusted. So for example, the Canadian Emergency Business Account and the parameters that you had to fall into to be able to access that in terms of payroll. It used to be 50,000 is the bottom limit. That was decreased to 20,000. Again, in response to what we were hearing from the business community. I'm not a business person, obviously, so I'm not going to know all the details of all these programs. I have on the line Robert and Charla, who I think may understand these programs better than I. People like Charla's been working with EI for years, so if you have any questions about the applicability of EI, Charla's going to know the answers more than I am. The devil's always in the detail. And a lot of these programs, there is detail. Some of them are just being rolled out, so the detail isn't there yet. But obviously, if you have a question, some of the answer is going to turn on the details, and I don't always know the details. Sometimes the details are not out. So we can follow up with people at our office, and that's what I encourage you all to do, because I think that's a lot safer than me giving you an answer which may not be totally right. But anyhow, we are here, as Patty said, to listen to what you have to say. I think the government has, as much as possible, tried to tailor these programs to meet the needs of the public. I think whoever wins in this game is the country who has the fewest number of deaths, the fewest number of cases, and who manages to get through it the most unscathed in terms of the economy and the people, and keeping everybody afloat. So with that, I welcome your questions too.
Super. Thanks so much, Marcus. So we do have a growing list of questions here. So the first question is from Rosalind Lockyer. And Rosalind, if you want to unmute your line, there you go. You're ready to ask your question.
Yes, good morning, everyone. Thank you very much, Minister Hajdu and Dr. Powlowski. Paro's been working really hard during this pandemic, and we've been doing weekly reports coming from our conversations and our counseling with the women through the week. We've been putting it up through the senior managers of federal and provincial funders, and they've been putting it up through the government. And I want to thank you. I want to thank the government for listening, because just about everything that the women have said to us that they needed changed has been changed in order of where they're how desperate it was. I think the last report I put rent everywhere in caps so that people would see what a priority it was for people. Now there's still people falling through the cracks, and we know that, right? It's and we'll continue to endeavor to communicate with the women so that we can get that message up. But the one that comes to the top this week is, you know, we've been working with the women to pivot, to use technology better, and to be able to change their operations so that they can serve people through the pandemic, but at the same time thinking about what they're going to do into recovery. And with that, their biggest concern is, and this is where the question comes in, they have a lot of uncertainty as whether the supports that the government is putting out will end, say, if, okay, we're all opened up now, and that will be the end, because their fear is that a lot of the people have now, you know, they have a habit of probably ordering from Walmart or Amazon or one of the big companies, and they fear that they won't have clients coming through their door because they're still going to be a bit afraid of the virus, for sure. So they're hoping that government would consider phasing out some of these supports and not just ending them because everyone's back to work. Because so that is one. Do you consider that can be so? And the other point, and then I'll keep quiet because I know there's a lot of people who want to talk. I did a presentation for the Ontario Not-for-Profit Network yesterday, and there was over 200 not-for-profits on that Zoom presentation and participating, and their fear was that government does not realize the vital role that they play, both as service agencies, but also in our economic values that to the community, jobs, etc. And they fear, because they heard that in Manitoba, one of the things that was going to happen was that some of the funding for organizations was going to be canceled, and some would not be refunded as much. So that's a big fear, because during the pandemic, all of us that I'm talking to, the not-for-profits are working twice as hard to be able to serve the public. And so we don't, the not-for-profits wanted to say do you think that there will be ongoing support so that they will be able to plan for their opening and know that they are going to be able to continue to serve the public, because now the public need it more than ever? So those are my two questions.
Thanks, Roz. So I'm going to pass that over to Marcus. Do you want to start with that?
Yeah, there were several parts to it. One, I think, was the business of whether these programs are going to be phased out. And yes, my understanding is that that is what is being contemplated at the moment, that they will be phased out rather than abruptly ended. Although I don't know whether those decisions have yet been made. Obviously, in terms of response to the pandemic, there's kind of various phases. And so far we've been on phase one, which is making the necessary changes to try to stop the spread of the disease, to flatten the curve, to prevent overwhelming the healthcare system. And so most of the measures at the moment have been dealing with that. And I think thanks to Patty and the people in the Ministry of Health, I think that's largely been successful. Now the next kind of phase is about reopening the economy, and I think that's an ongoing question and something that really the provinces have the lead in. But in terms of our support programs, yes, my understanding is it will be phased out. Now, there's no chapters in the economic books about how to get over a pandemic. So there's no crystal ball as to what's going to be done to get out of this. I think one of the things you kind of alluded to, though, is that things are going to change as a result of this in various ways. Some for the good, some not so much for the good. So for example, with respect to tourism, I'm not sure whether there's going to be a big appetite after this for a lot of people to visit China or maybe even Europe. There may, however, be a big appetite to go to Northern Ontario to a fly-in fishing place, because, you know, I don't think you're going to catch, well, hopefully you'll catch something there, but not the kind of things you want to catch, not the things you don't want to catch. So how this is going to affect us, and I know a lot of people out there who are involved in various businesses, nonprofits are looking at how things are going to be changed, and I think they will. Just like, heck, I'm making French bread. Well, I made it once, but hopefully more. But we're doing, a lot of people are making bread. A lot of people, I think, are going to be, I'm going to spend a lot more time in the garden this summer growing my own food. I think a lot of people are going to be more interested in sourcing their food locally, relying on themselves. So I think a lot of things are going to change. But
Charla, maybe I could just add a couple of things. In terms of question one from Roz, absolutely. Those are the questions that we're asking right now. The post-pandemic planning and measures, how we alleviate those measures, or how we ease off those measures, are all really important questions. I think everybody realizes that you can't sustain a 75% wage subsidy for eternity, but we also believe that there needs to be a gradual release of measures so that you actually help people transition to a fully functioning economy. And it would be in nobody's interest if we let any business fail. We know that we'll lose some, but the goal right now is to try and sustain as many as possible. So as you do that thinking, Roz, with your groups, it would be helpful to hear more sort of specifics in terms of what people think would be helpful in that transition time, understanding that there will be a transition at some point. And so any intel that you gather from your groups would be very, very helpful, and I'd be happy to receive it. In terms of the not-for-profits, yes, absolutely. Just so you know, there has been already an initial funding of $350 million in emergency community support. It's called the Emergency Community Support Fund. They all have the same name, roughly. I can't keep them straight, but essentially $350 million for not-for-profits, largely distributed through some of the national bodies like United Way, but other money going directly to community. And then there's also supports for the sheltering and food banks folks in particular, because we know that they've had such a surge in activity in this particular time. So 157 million to shelters in general, another 50 million to women's shelters, and then 100 million to feeding programs, with 30 million for local local food banks, but a lot of that delivered through national sort of organizational bodies. I know the DSAB is really active in the space of sheltering right now, and thanks to the calls that Marcus is organizing with the hospital and the health unit and other levels of local leadership, it's been really great to hear the thinking and the strategy on supporting the homeless population, for example, and I know the DSAB received extra money to do that. So we've been working to make sure that we protect that sector as well. And again, thoughts are always helpful.
Awesome. Thank you so much, Patty and Marcus. So our next question is from Shivan Karania. Shivan, go ahead.
Good morning, everybody, and the honorable ministers. I'm an international student here at Lakehead University. My question is, thank you for all the benefits provided. As international students here, unfortunately, some of us can't go back home, and most of us don't qualify for CESB nor for CERB. And most of us over here haven't received any monetary help from the relief fund set up by the university either. Also, many jobs are not available for us due to the lockdown. Can we see any help in future for us international students, just like normal students? And like, I know some of them are also getting voluntary work. Money goes toward the tuition. So is there any program could we see for international students set up in future as well? Thank you.
Okay, maybe we'll go to Patty for a response on that one first, if we'll kind of switch back and forth. Patty, are you?
Yeah, thank you. Sorry, I've been muting. I've been muting myself in between, so that's not. I hear you. I've heard this concern from other international students as well, both locally and internationally. I know that we've been trying to figure out how best to support international students, and it's a work in progress. Some of the measures that we've been putting into place with community organizations, of course, are helping, but I think you're right, there's a gap there, and I'll continue to go back and push for more tangible supports for international students. I don't have much more than that for you right now.
Yeah, I agree that this has been something that's frequently come up. I know the international students contribute a lot to our economy. I can't remember the number, but 20 billion or something. But they are an important sector of the economy, and a group that we shouldn't forget about. My understanding was that one of the things that the government did put out is to allow foreign students to work up to 20 hours per week if they're engaged in what is interpreted as an essential job. And there's a list of what constitutes essential jobs, but it includes working in the food industry, for example. And certainly healthcare is another one. So there are some work possibilities for foreign students in those sectors, which will hopefully help them get them through these times.
Awesome, thank you. Our next question is from Jason. Jason, go ahead.
Thanks, Charlotte. Hi, everyone. Minister, MP Powlowski. I just want to start by saying thank you so much for everything you both are doing. This is an incredible time to witness what a pandemic can do. So thank you for all your long hours, and I imagine that sleepless nights also. So my question is more revolving, and I don't even know if it's a question, but maybe just something to put on the radar. Obviously, Thunder Pride was successful in a FedNor application this early part of the winter, or late part of the winter, and a lot of that money was contingent upon hosting a Pride celebration in June, which we now have moved potentially virtually in some form, but won't be holding an in-person Pride or festival. And we also have a conference that may or may not be able to be held in person in January. So a lot of that funding was contingent upon, the plan at its original stage. But in discussions with FedNor, there's some, they've been very good, and I'm not going to say they haven't been, but there's some concern on my part that we won't be able to extend that past the March 31st, 2021 date. And the fact that we're moving some of our Pride online, some of that funding is not needed at this point, but it would be needed then for 2021. And the conference, obviously, there's contingency plans being put in place for that. But my ask of, I guess, both of you would be to see if we can extend some of that funding out even 6 months post year end 2021, which would allow for not just our organization, but other organizations, especially under the Community Experiences Fund, to use that money through the summer of 2021, when their Pride celebrations would hopefully be more in person than they are this year. So that's it. It may be a question, it may not, but I just wanted to kind of put it on the radar.
Thanks, Jason. Marcus?
Yeah, so a couple things. Patty's probably going to be better able to answer this question than me, but there is one of the rollout of many benefits. There's the $500 million COVID-19 emergency support fund for culture, heritage, and sports organizations. So I think maybe you would fit into that. But the other part of the question, I think, related to FedNor funding, if I'm not mistaken. So the funding for the Canadian Regional Development Agencies, which FedNor is one of them, has been increased by $675 million, with a further $287 million for Community Futures Network. So I'm not sure if your money's coming from them, but I did speak to FedNor and Terry Sheehan, who's the parliamentary secretary for FedNor, about looking at whether FedNor may not, and I don't think they've rolled out yet how that FedNor funding is going to actually look like. But one of my suggestions and hopes was that some of that FedNor money would go towards previously sponsored projects which are in jeopardy because of the COVID outbreak, because it would be a waste of money if things were started, but because of COVID-19, they never materialized, so the money would have been sunk and lost. Or as it seemed to me, better to try to top up those things to keep them going, rather than maybe starting a lot of new things. But I don't, maybe Patty, you have more to say than me.
No, I just, no, I think it's good that you point out that FedNor's got some boosting funding capacity, and just, Jason, I think that's a really specific case that we can work on with you in the office. I can't imagine why we wouldn't be able to extend that deadline. It doesn't seem reasonable that they wouldn't agree to that, but we can make a very strong and compelling argument for you, as you know we're good at. So we'll take that on. And I just wanted to correct myself on CERB. I got a very helpful text from Crystal, who said that Shivam would be eligible if he meets the criteria for the CERB, which is the Community Emergency Response Benefit. And so that is eligible for students, and they are also able to work 20 hours. The 20-hour limit has been lifted. So students that do have a job can work more than 20 hours. So just to correct myself and let everybody know if they've got international students amongst them, to let them know as well.
Awesome, thank you.
Thanks to Crystal for getting me the information.
Yeah, correct me if I'm wrong, Patty, but then they have to, for the CERB, you have had to made $5,000 in the last year and have a social insurance number.
That's correct, but yeah, you're right. This would be for students that have already been holding part-time jobs in the year.
Perfect. Okay, I think the next question is for maybe specific to Minister Hajdu, because it is health related, and that's coming from Jane Slivchak. So Jane?
Hi there. Thank you for meeting with us this morning. I'm a family physician in Thunder Bay, and I'm one of the associate leads at the Fort William Clinic. Our clinic services 16,000 patients in Thunder Bay. And so my question is around PPP, access to PPE and the costs. So just to give you an idea, but prior to COVID, our physicians and other allied healthcare workers would see over 500 patients a week. Currently, we're seeing around 150 in the clinic, and the rest we're servicing virtually, so mostly through phone visits. But I foresee that, you know, as things open up, we'll be seeing more and more patients, and I think we're going to need to. I mean, you know, I can't defer some of the physical exams that I have been, and so I really worry about access to care and just doing a good job as a physician. I wanted to mention that since March 18th, our clinic has spent $18,400 on PPE. That said, we're only seeing about 150 people in the office. So the costs are astronomical, and we've been footing the bill. And I'm worried that as we get into flu season again into the fall, with many people presenting with respiratory type illnesses, distinguishing them from a regular virus to COVID, we're going to need to protect ourselves, our staff. And if we're protected, then we're protecting the patients in case we've already become infected and are asymptomatic. But that's just not going to be sustainable. We'd be looking at it maybe $3,500 a week on PPE when things really hit. So we are also a small business, and we also feel obligated to provide good care to our patients. And I'm getting emotional, but I don't know how we're going to do this. You know, if we can't pay for the PPE to protect ourselves and our patients, we won't be able to see them, and we won't be able to give them good care. And then where are they going to go? So my question is, are we going to receive any funding from the federal government to obtain PPE? Number two, will we have access to it? We are having a really hard time finding masks, gowns. We've been able to source some, but I'm fearful we're not going to have enough. So thank you.
Well, thanks, Jane, and thank you very much for the hard work that you're doing. And I know that for healthcare workers and those on the front lines, I think I speak for everyone on the call when we just say we are so grateful for how hard you're working and how difficult it must be, especially as you try to adjust your practice methods to treat people in a time where physical presence is not easily obtained. And you mentioned virtual visits, and I know that one of the things that I'm considering as a federal health minister is trying to ensure that there is the capacity for those billing changes that allow for virtual and telephone visits to continue, because as you point out, it's not appropriate for all visits or all patients, but it certainly is something that pre-pandemic we were really hoping we could achieve, is more virtual medicine as a way to get more medicine to people in more difficult situations. And so thank you for that innovation. On the issue of PPE, I think it comes as no surprise that this is an international challenge right now, the demand for PPE, as we see a global pandemic in the midst of in our midst. It means that every country is competing vigorously for every ounce of PPE, and PPE production in countries that we've relied on for a long time, like China, is not at the same capacity, because they were obviously first in line to receive the surge. And so as they become sort of more tooled up, we're starting to see more equipment come out of those places. But we've also got, as you know, much going on in terms of domestic production of PPE, including gowns, for example, that are one of the, as you point out, one of the more difficult items to actually procure. Much has been made about N95 masks. They're very important and very also difficult to procure, but actually gowns are it turns out, one of the tightest products that we're really finding it challenging to procure in the marketplace. I have to give full credit to my colleague, Minister Anand, who's running an amazing team. And I think it's either up now or very soon to be released. There'll be a PPE tracker, a federal tracker that will show the numbers that we've actually ordered from both domestic and international sources, and what we've received as a country. So that's part one, is that we're fully engaged. There is an actual subcommittee of the COVID committee that is fully dedicated to PPE access and production. And that committee meets at least a couple times a week to talk about what's working, what's not working, ongoing challenges, and also, how we can further sort of accelerate the domestic production. And I think it's going to be a conversation we'll be having for a long time, because as you know, this virus doesn't have a cure or a vaccine right now. And so as we learn to live in the new normal with COVID-19, obviously PPE is going to be incredibly important, as you point out, as as you go into flu season, as we continue to live and work to tamp down this virus in our own communities. So having said that, in terms of the distribution of PPE, that is completely within the provincial and territorial jurisdiction. We are trying to supplement, like the procurement that we are undergoing right now is for the entire nation, and then it is allotted to the provinces and territories based on a formula that we've agreed upon with them, which is 80% gets allotted across the country, 20% is held back in our national emergency stockpile for issues of surge or other kinds of crises where we'll need to help distribute PPE rapidly. Having said that, I'm not sure exactly, and Marcus might be able to speak to this better than I do, but I'm not sure exactly how the billing relationship goes with the provinces and territories. So it seems to me like that is a conversation that has to happen with the Minister of Health provincially in terms of your extreme costs. And so I'm happy to take that back to my table though and flag it, because it seems to me like that's an important consideration for us federally, that if small clinics like yours are bearing a disproportionate financial burden and are at risk of not being able to provide services to a community like Thunder Bay, that is actually very concerning to me as the federal Minister of Health. It doesn't mean that I necessarily have the tools right now, but it's certainly something that I can flag. I have a bi-weekly call with my FPT counterparts, my provincial territorial health minister counterparts, and I'm glad that you've raised it, because I didn't realize that there was a billing relationship where you would be paying for PPE, and then I suppose you submit those bills to the province. Is that how it goes? No, you get a flat allotment of a funding for the services you provide, all inclusive.
Yes. So I know that the OMA is advocating that we get some reimbursement for PPE, but as it stands right now, there is no reimbursement for PPE. So
Okay.
we are paying for it. So I'll just give you an example. For a regular visit that most family physicians, they bill $32. 40% take that off for overhead, $19. Take off $8 per person that it's costing us in PPE right now. It's not sustainable. So we are paying for it outside of what we get paid to see the patient. We have to take it out as an overhead or a cost, right now.
Okay. That's a really useful flag, Jane. So let me bring that back to my team, and we'll get back to you one-on-one in terms of what potentially we could advocate for at the federal government, or any solutions that we might be able to come up with. Thank you.
Thank you so much. I really appreciate it.
Awesome, thank you. We'll move on to our next question, which is from Diane Petryna. She's written it out here, but Diane, do you want to ask that question?
Oh, hold on. I feel like I want to respond
Okay,
to
you
that.
want to carry on?
Ask
Okay,
me,
sure,
but
no worries,
I have been practicing medicine for 35 years, so I do have a response. So for Jane, this is part of the cost of doing business, and as Jane pointed out, the money the family doctors get comes from the OHEP fee schedule, which, as Jane knows, has been frozen or reduced over the past number of years by the provincial government. This is an added cost of doing business that I think the province is going to have to pony up for and pay extra money to the family doctors to allow them to continue to do this, because that's part of the job. And as she knows, you have to protect the patients. And so they're going to have to come through with something. Now, the federal government puts up 25% of healthcare funding. So is that going to be reflected in higher transfer payments to the provinces? I'm not sure. That's up to Patty, but I do agree this is a problem. And the problem with PPEs is certainly central to our management of the pandemic, and especially for people in the healthcare profession. I think it's important that all levels of government, including the hospital, are transparent as to the availability of PPEs and what they're doing in order to get PPEs. I don't think that's always been the case, and I think that's resulted in some concern, loss of faith among people, frontline healthcare workers, that keep being told that, yeah, the PPEs are coming, but don't see them coming. I think the government in all layers, it's not just the federal government, the province, the hospital, have to be more transparent in telling the frontline workers how many PPEs they have, when they're getting them. And I know Patty's absolutely right. There's a global shortage of PPEs. Everybody's competing for them. There's all kinds of people out there who are kind of coming forward and saying, we can get you PPEs, but can you trust them? They want the money up front beforehand. It's a big problem, but I think, and again, whether it's the hospital or the feds, the promise, you have to be transparent as to what we're doing with PPE. So I certainly welcome this having an online tracker so we know where they're coming from.
Awesome. Thank you, Marcus. I didn't mean to cut you off. Sorry about that. Diane, over to you. I've unmuted you.
Thank you. Thank you for the opportunity. Thank you, Patty and Marcus. I think I can speak for most everyone I know in Thunder Bay that I am so incredibly proud of the work you're doing and representing Northern Ontario, putting Canada on the world map for doing so much at the right time with the right heart. So thank you so much. Those who don't know me, I own a store called Take a Hike and Take Two Boutique. We've been around for 24 years, but since mid-March, we have been closed. I participate 3 times a week with the update meetings with the Retail Council of Canada. I've started my own Facebook group called The Passionate Retailer to bring independent retailers together to learn from each other, to support one another through this pandemic and beyond. Small stores, when we talk about small business, it's interesting that the definition of small business keeps expanding. Most recently, the rent program defines a small business as having revenues of $20 million and rents of $50,000 a month. It's kind of hard to compare them to me. But independent retail, oh my goodness, my power's gonna run out of my, can we get back to me, Charla? I have to plug in my my laptop. It's gonna run out of power. Okay.
Okay, we'll come back to you.
Do it right.
So why don't we move on to Sue Perdaniuk then, and then we'll go back to Diane when she gets her power issue sorted out. So Sue, go ahead.
Hi, everybody. Thank you very much, Minister Hajdu and Dr. Powlowski. I do want to send a shout out to Dr. Powlowski for the work that you did with Bombardier. I think that was a really excellent process and got some people, or is getting some people back to work. And, you know, thank you for that. I think that's a really, it shows the innovation, I think, that can be had in the North. And of course, Minister Hajdu, I mean, what can I say? I've already said it to you personally, but I think that, you know, keep going, because I know it's tough out there. My question is really perhaps all encompassing. I was trying to think of what would be the best thing from a high level to ask you. And I think one of the things I've really been focusing on lately is a transformational strategy, a strategy that's going to get our region, perhaps our city, our region, to be to really move forward once we're able to, in a very collective and thoughtful way. And that means right from healthcare and long-term health to our hospitalization and our physicians, to economics and, you know, where we sit. And I try to think, because we're not recognized as really formally recognized as a regional government per se, we have limited ability to do that in a collective way. But I look at perhaps something like FedNor and divesting some actual project dollars in there for this transformation to help us support getting the North back to business would probably be a really good, if you will, pivot for what it's doing right now. And you know, accepting applications, processing them, and I'm sure that they'll extend any deadlines that you may have, because I've done it before. So I'm really looking at that as an all-encompassing strategy, and I'm sure the rest of the country is looking at that. But certainly in the province of Ontario, as both of you may know, and all of us know, we're really looked upon as one Ontario, even though our differences are so far apart, and we know that, and there is no regional disparity decisions being made to support the fact that we're so different. So I know that always sounds like the North is crying, but the reality is we always get the bad stuff and we rarely get the good stuff. So, you know, it's just something that has happened historically over time. And in FedNor, which is a federal jurisdiction, and also I've been bringing this forward to our Ontario counterparts, what is and can we build a fund and a plan that's collective to bring the Northwest, maybe the North might be easier, more palatable, together to build a transformational plan post-COVID, because I don't think it is going to be the same.
Okay, sure. I'll start. I like big thinkers. Thank you, Sue. And you're right. I mean, I agree with you. I mean, it's hard to say, right? I mean, it's hard to predict what's going to happen, but I do think you're right. There's an opportunity here. With every crisis, there's a silver lining, someone said once, and I keep telling my team that from a health perspective. Marcus talked about transfers earlier, and I think that one of the things that politicians, if they're not already thinking, should be thinking, is that this is a wake-up call that if we don't have a strong health and social sort of safety net or cohesion across the country, then we are very prone to things like this really sort of decimating our way of life. And it's been a real, I think, eye-opener for many, many people. But listen, Sue, I'm always interested in your big thoughts and your big pictures. I think there's a real appetite for sure within our government and within the cabinet in particular to be thinking big and to be thinking about how we rebuild in a way that's sustainable, in a way that actually builds on the strengths of Canada, that recognizes regional differences. There's a real understanding of the divide between rural and urban in a way that I haven't seen in a long time. As a semi-rural MP, it always frustrates me when I, for example, am on the road to Manitouwadge and my team wants to have complex teleconferences and they don't understand that I'm going to lose cell service for an hour and not be able to rejoin them when the call drops. And these are like, you know, political staffers that oftentimes have come from urban areas that have never lived in an area where the availability of internet is an issue. And so I think, you know, we've really understood that at the health level, just how fragile we are when we don't have any equity, for example, and access to tools that make businesses thrive in Northern Ontario. How can you have an online store if you don't have reliable internet? You know, trying to work with people in Gull Bay, for example, and they don't have internet or cell service. Well, it's pretty hard to get digital tools up there that would help them do self-assessments, for example, or use the apps that we've been developing that are actually really great for 95% of the Canadians out there, but for the other 5%, you know, is not working. So all that to say, that's exactly where our headspace is at as a government, is how do we rebuild stronger in a more equitable way that actually addresses some of these vulnerabilities that have existed for a long time. And just on a personal note, you know, for me, this is really shining a light on what many of you heard me say when I ran the shelter, which is that good social policy is good fiscal policy and it's good health policy. You know, we knew that, for example, in the homeless population, that we had explosions of illnesses that could present a risk to the general population. The difference was those illnesses are a little harder to contract if you're healthy, if you're well housed, and all of that. Now we have an illness that's easy to contract no matter what. And in fact, if we don't actually take care of those vulnerable populations, whether they are seniors in long-term care or whether they're people living in homeless shelters, it actually does pose a risk to everyone else and to our economic sustainability. So I think there's an opportunity here to think broader and bigger about a much better approach. And Northern Ontario has an incredibly important role to play. I'm so proud of Northern Ontario, and I think I'll be excited to hear your thoughts as you develop them with the other leaders. Thank you.
I'm obviously a lot newer to this than Patty is. I would point out that the Northern Ontario caucus seems to be fairly strong, and you're absolutely right, Sue, and that there's a lot of difference between a place like Thunder Bay and in downtown Toronto. I think in a lot of ways we're closer to Manitoba than we are, well, we are physically for sure, but in terms of the kind of place we are, I think there is an opportunity probably for all layers of government to make the North stronger as a result of this. I think some of the things that have come to light are things that we ought to capitalize on. For example, I think it suddenly become, maybe not suddenly, but it's become apparent to many layers of government that the safety of these northern fly-in indigenous communities is really important. And yet we don't really have a safety net or a way of addressing the problems in those communities. But this is an area where I think we ought to be putting some resources in paying attention how to better service those communities. Now, where are you going to center that little micro industry around trying to strengthen support for those northern flying communities? It would seem Thunder Bay would be the place. So there's an opportunity, but I think there's a lot of opportunity for doing things locally, because I think, as this is illustrated, supply chains that involve other countries are potentially a security risk. But even within this country, if we're totally dependent on Toronto or a slaughterhouse, for example, in Guelph, as we are, that this is a problem. We have slaughterhouses in Emo, we have a slaughterhouse in Murillo. We have local sources of food. I think as a result of this, a lot of people will be more interested perhaps in trying to source things locally rather than from other places. And this goes against the overwhelming trend over the last many years towards globalization, but it's a return of the importance of doing things locally. And I think that will help and can help our economy. But I think you're right too, and that I think we ought to be looking at things like this as an opportunity to maybe develop in a way that we hadn't thought of developing before.
Awesome, thank you. So we have time for one question. We're down to sort of 5 minutes left. And so Diane, I'm gonna go to you, but I'm gonna ask you to get to the question right away as we only have 5 minutes left. So I've unmuted you. You're
Super.
on.
I, like a lot of other businesses, have been benched. Trying to figure out how to best use my time. I'm in a sector that will likely take a very long time to recover because of physical distancing and so on. To hold my business in, I'll put it on ice, is over $10,000 a month of costs to me. So I need to use this time effectively. I need to either get another job to just keep the store on ice, or I need to use my time as a time to invest in the future in innovation. And retailers have been excluded from applying for dollars. And the question says, it's a time to reset. And when we talk about the region, it's more than forestry and tourism and so on. Innovation can come from every part of this community, businesses large and small. Is this the chance for us to finally, as retailers, have access to federal funds for research, development, technology, training, marketing that has been made available for many, many years to other business sectors?
Okay, who wants to take that one? Patty.
I could listen. I think it's a great time of transformation for retail, and we've talked about that a lot, both in your store and in person in my office, about how the sector itself is transforming and was transforming for better or for worse in some ways as pre-pandemic. And I think the pandemic has really accelerated, for example, people's purchasing online desires and all kinds of things. So I think it's a great idea. And I think we're very concerned about retail and especially the sustainability of small retail businesses like yours in communities that are the drivers of local economies. There's multiple challenges that I've heard over the years as a member of parliament from the rising costs and decreasing sales. but also on the flip side, how difficult it is to attract people to the retail sector, the wages of retail sector work that doesn't allow for the stability of workforce. And I think we've talked about that before. Certainly we've seen that in even just what we're calling essential services, you know, the ability, the federal government coming in to support provinces and territories to boost salaries for people that are working in grocery stores and the like, really indicates that there's been a challenge in terms of how we even envision the value of people that are working within that sector. So I think there's an opportunity to transform how we support the retail sector to stay strong in Canada. I can't imagine the loss of the many small businesses in Thunder Bay, and not just from an economic perspective, but from a quality of life perspective. For me, one of the things that makes living in Thunder Bay so joyful is actually watching these businesses start and grow, oftentimes run by young people with lots of dreams, and, you know, add to the quality of life of our community. I want to buy local. I want to buy the soap that's made by Lovely Body and the clothes that Mars, you know, clothing is sourcing out. That's super cool, although usually doesn't fit me. And all of those, to be honest, but all, you know, all of those stores add to our quality of life, you know, to be able to go out there and purchase jewelry that's made by someone and sold on Bay Street, you know, that's unique to my community, is what makes me the most proud to be a Northerner. So I long words to just say, yes, I think it's a great idea and we should pursue it.
Yeah, I agree with Patty. Those are the little things that make life good. Yes, I think we want to do what we can in order to support the retail sector. I think Diane's told me that the retail sector is one of, if not the biggest employer in all of Canada, and we can't forget that. Obviously, this is a time of transition from retail, where a lot of people are doing a lot of buying online, and certainly, if anybody's doing really well with this, it's the couriers and Amazon and all those people that are shipping things out. I know, Diane, you've been doing some of that though. So, I mean, again, this is an opportunity maybe for online things and transitioning to a different way of doing business. But I agree, this is an issue that ought to be addressed.
Awesome. Well, that is perfect timing. It is exactly 11 o'clock. So I want to just wrap up by saying thank you so much again to Minister Hajdu and Dr. Powlowski. This has been such a great opportunity for our members to talk to you directly about their challenges, and we really appreciate all the work that you're doing and continuing to put forward those local concerns to adjust and fill the gaps in the programming. And I really appreciate the accessibility that I have to your offices to pass that information along to you at such a busy time. And I just want to let everyone know, if you haven't already, we have a local survey that we have on our website, tvchamber.ca/COVID-19. I'm encouraging all business owners to please fill that out, whether you're a not-for-profit or a for-profit business. We want to understand what the situation is locally and whether you've had to lay people off, how your revenues have been impacted, whether the programs are working for you. And this survey will help us to do that. And then that will allow us to pass on that information to our MPs so that they can speak on our behalf with a bit of a broader perspective from hundreds rather than just individual examples. So please take the time to fill out that survey. It's open until Monday on our website, and we would really appreciate that input. So with that, as closing, just want to say thanks to everybody for joining in, and thank you again to our MPs for all the work you're doing and for taking the time to be with us today. And watch our website because next week we have a Northern Chambers teleconference happening at Town Hall with 3 Northern Ontario ministers. We'll have Minister Vic Fideli, Ross Romano, and Greg Rickford. So that will be happening next Wednesday at 1 o'clock. Or is it 1:30, something like that. Watch our website. We'll be getting that information out today, and that's also something where we'll be very informative to the Ontario government on what kind of supports they can do to help our local businesses. So thank you all, and have a wonderful day and enjoy the sunshine. Take care.
Thanks, Charla.